and modify. Stop, drop it low, but pick it up carefully. Work them glutes like you in physical therapy.
So now we will discuss about the urinary system. The urinary system lies in the lies in two system, upper urinary system and lower urinary system. The abdomen have only upper urinary system, which and the lower abdomen urinary system will be discussed in the peritoneum, the pelvic cavity. So the abdomen have only upper urinary system, which consists of kidneys and ureters. So the kidney, it is a bean-shaped dark red color. It's found at the T12 to L3 region, attached to the posterior abdominal wall just below the diaphragm. The left kidney is slightly above. The outer surface is concave and the inner surface is convex, which have a hilum. Every day, our kidney process around 200 liters of blood. Around 1 to 2 liters of waste is removed and in the shape of urine. So, kidney have two poles, two borders, and two surfaces. The superior pole, inferior pole. Two borders are the medial and lateral border, and two surfaces are the anterior and posterior surface. Kidney is actually 10 centimeter long, 5 centimeter wide, 4 centimeter thick, and 120 to 170 gram in weight. It has a fibrous capsule at first layer, and then adipose tissue, which is called as the perinephric fat, and the renal fascia, which cover the at the outermost side. The renal fascia is divided into two parts. The first one is the fascia of Todd, and the posterior renal fascia is called as Zucker, the Kendall fascia. The anterior fascia both join together in front of the vessels, while the posterior fascia connect from the posterior side, and that's why they are called as the fascia of Zucker Kendall, and it connected to the abdominal, connect the kidneys to the posterior abdominal wall. So the histology is moving from inferior to the superior side. The structures that form from inferior to the superior is the ureters. The first one is ureters, and there is a pelvis. The renal pelvis have a compartment within them called as the renal sinuses, which is filled by the fat called as the renal sinus fat. Then major calyces, minor callus, the renal papilla, the renal papillary duct, renal medulla, the renal cortex, which is actually a dark brown in color and is soft granule in persistent, and is 4 to 11 mm thick, and there is extension from the renal cortex to the medulla called the renal columns. The next we will enter into the nephron. The half of nephron lie in the renal cortex, and half of it lies in the renal medulla. Within the cortex, we have the renal corpuscle, proximal and distal convoluted tubule, and the other half, which contain the in the medulla, is the loop of Henle. So the renal cortex is composed of renal corpuscle. Now, until this part, plasma has been infiltrated into the primary urine. So, where only plasma is infiltrated out. So we called it is the primary urine. The next component of the renal cortex is the proximal convoluted tubule, then distal convoluted tubule, while the rest part of the nephron is lie in the medulla. So in medulla, the medulla has a loop of anal of the nephron where the primary urine converted into the secondary urine by absorbing the salts and minerals from it. It consists of renal pyramids, which is around 7 to 18 in numbers. Renal medullary rays, which is basically a fiber that extends to the cortex, and each of it has the lobes, which is called as pyramids, and pyramids has a base and the apex. So the apex of the renal pyramids form the renal papilla, having openings of the papillary ducts, minor calyces, and 2 to 3 renal major calyces, which then form the renal pelvis. So mechanism of action of the kidney. So when blood is bring to the start part of the nephron called as the renal corpuscle, which start the portion which start filtering the blood and separate the plasma from it, so called as the primary urine in the glomerular. Now the primary urine go to the proximal convoluted tubule, then the loop of anal, and finally distal convoluted tubule where it becomes secondary urine. So collected by the from there collected by the collecting ducts, move into the papilla, and then into the papillary ducts, then into the minor calyces, major calyces, then to renal pelvis, and then into the ureters. So the function of the kidney is plasma filtration, excretion of waste, acid-base homeostasis, vitamin D metabolism, hormone production like for example hematopoietin, and all of them is done in the nephron. So the relation of the kidney. So right kidney, we will discuss right and the left kidney. Note that many related structures are directly in contact with kidneys, whereas the visceral layer of the peritoneum separate others. So anteriorly we find the suprarenal gland, some part of suprarenal gland, the liver, second part of the duodenum, and right colic flexure. Posteriorly, we will find the diaphragm, costodiaphragmic recess of the pleura, Phelps rib, psoas muscle, quadratus lumborum, and the transverse abdominis muscle. And other structures are the subcostal, iliohypogastric, ilioinguinal nerves, which runs downward and laterally. So the left kidney we will found anteriorly the suprarenal gland, spleen, the stomach, pancreas, the left colic flexure, and coil of the jejunum. The posteriorly we will found the diaphragm, costal diaphragmatic recess of the pleura, 10th, 11th, and 12th ribs, the source, quadratus lumborum, transverse abdominis muscle. And same as the right kidney have the subcostal iliohypogastric, ilioinguinal nerve, which run downward and laterally. Now, so the blood supply of the kidneys is directly from the renal artery, which directly arises from the aorta at the level of lumbar vertebrae. So the renal arteries have five segments. The lobar arteries enter the hilum of the kidney. The interlobar arteries arise from the segmental artery, one for each pyramid before entering the renal substance. Each lobar artery gives 2 to 3 branches, runs toward the each renal cortex in the medulla, and form the arcuate artery, the interlobular artery of the arcuate arteries, and then the last one is the efferent glomerular artery, which arise as a branch of the interlobular artery. Lymphatic drainage is directly into the lateral aortic or para-aortic lymph nodes. Nerve supply is from the renal sympathetic plexus. Efferent nerve travel through the renal plexus, enter the spinal cord into the 11th.
If it hurts to modify, stop, drop it low, but pick it up carefully. Work them glutes like you in physical therapy.